Hey guys, this is Dr. Brenden Cochran coming to you from Interactive Health Clinic. Today I wanted to talk about face coverings, gloves, and what do you do? So now that these are recommended to wear a face covering, whether it be cotton, some homemade mask, or even wearing gloves when you're out, let's discuss some proper ways of doing it versus potentially bad or harmful ways. And the reason I want to say this is, we had to go out for some groceries this weekend, and it was very disturbing what I saw people were doing. So first of all, let me take this off. Notice if I grab this mask, these gloves, I've now contaminated my face, right? So that is improper. So I'm going to set this aside for a minute. I'll come back to this. I'm going to start with gloves. So what do gloves do? Well, they do protect you from getting other stuff on your skin, so then it reduces the amount that you have to wash your hands off, right, of the virus. Here's the problem with the gloves, though. These are a type of plastic, and remember we said that plastic things we can find virus for up to 72 hours on the plastic itself. The other thing with gloves is your skin has things like defensins and pH that's low to help kill things that land on it. So your skin is an active barrier that kills viruses or bacteria when it lands on it. When you're using gloves, guess what? You don't have anything on here that's going to kill the microbe. So what the heck is the purpose of gloves? Well, the purpose of gloves, if you have to go out somewhere and you have to get things, right? Then you might wear gloves. Here's the thing with the gloves, though. Understand that when you're wearing gloves, treat them like you just dipped your gloves in dog poop. That's the image I want you to have if you're wearing gloves. Dog crap is all over your hands. And if you think of that, then you'll be really cognizant that you're not touching things. Because if you go and you grab things and you're at the market and then all of a sudden, I get my cell phone out, I start talking on the phone, or I start touching my face with my gloves, or I grab into my purse with my gloves on, or I grab my keys, or I go into my vehicle, start my thing, leave the gloves on the whole entire time. Guess what, guys? That's on your gloves, and you're literally spreading it from there to there to there to there to there. So the purpose of the gloves is literally you're out, you need to be basically locking yourself to say, I'm not touching anything else other than the things I have to get, like the doorknob, or if I'm at the grocery store, I'm grabbing produce or grabbing other things. That's the purpose of the gloves. After you have touched those, though, when you're in your safe zone or about to enter your safe zone, you have to take the gloves off like this from reverse, and then you have to wash your hands really carefully, all right? So that was kind of disturbing this weekend that I saw a few people literally come out of the store with their gloves on, grab their keys, get in their car with their gloves on, and then drive away. And remember, everything that you've touched in that store is now on your gloves, and you're contaminating everything. So treat your gloves like you just handled some dog poop in the backyard, right? Everything you touched after the dog poop is now going all over the place. That includes your mask, right? So if you have a mask on, and you're touching your mask with your gloves, or you're touching your face to take the mask off, guess what I've done? I've contaminated all over my face. I've contaminated the mask. So that's really important as well. So now what about masks? Now, we've been talking about masks extensively, and then finally you saw it's now recommended people wear some face covering for protection, right? It's mainly to protect you from like sneezing or coughing and spreading it to other people. It does give you some resistance against others if it's a cotton or surgical, but it's not really protecting you that greatly. But it is better, again, like we talked about before, than nothing. It is a barrier. So what about masks? Well, if you are going to reuse these suckers, you have to disinfect them. Why? If you wear a mask like this, and guess what? You're out and about wearing a mask, that stuff's getting trapped on the mask surface. So the worst thing you could do is I have my gloves on or my hands, I'm touching my mask, and then I'm touching other things. Technically, you're contaminating, right? The good thing about the mask is it's preventing you from touching like your nose and your mouth, so you're not entering those bugs into those mucous membranes, which is most common. But think about this. When you take your mask off, don't be touching the front here. If you do touch the front or you make that mistake, make sure you wash up really, really well. Make sure you're washed before you take this off. When you take this off, you have to clean this. And one of the concerns that we know is surgical masks or cloth masks, if you do have a viral particle that lands on there, it can live on here for several days. It's not like cardboard where it's 24 hours. So this is several days. We're talking up to 7 days of live virus on here. So what that means is if you're touching in here or you touch out here, you're contaminating everything. So reuse anything. If it's a cloth thing, you can rinse it, right? If it's a mask, then you have to use a different technique. And in some of my videos, I talked about you can use heat at 158 degrees, as long as you don't have a gas oven, because then they'll catch on fire. You can also use hydrogen peroxide. Duke University is actually treating these with 35% food grade vaporized hydrogen peroxide in a room. So they'd hang and then you'd basically vaporize. And they did that in about 20 minutes. Or you can use a UV light over them for, depending on the UV spectrum, for at least 30 minutes. The other thing is if you have multiple different coverings of masks, you just have to set them somewhere and basically wait it out for a week and have at least 7 masks, so that way you're not reusing that. So hopefully that's helpful with the masks and the gloves. I just want to be really clear with that because it scared me when I saw people walking around and they're like touching their face and touching their phone and just cross-contaminating. It's just like, why are you wearing the gloves? Don't even bother wearing the gloves. So that's first thing. Now, what are effective disinfectants? We know that 62 to 71, basically let's say 60 to 70% alcohol. Now this could be your isopropyl alcohol that you use at home, or it could be something like a grain alcohol that you might drink like Everclear. Either one of those are effective enough at basically disinfecting things. That would be like surface tops, phones, those types of things, those objects. It's not something you want to soak your mask in. Please don't do that. Another thing that works pretty well is hydrogen peroxide. We talked about that. It doesn't need to be 35%. It can be 0.5% is all you need for disinfecting. So 0.5% is enough. Most of the stuff you get over in the brown bottles is 3%. Do know the brown bottles never are supposed to be orally or used because they do have other chemical stabilizers in them. So 0.5% is all you need. Or you can use 0.1% bleach. And really the kill time on these is at least 1 minute. So you have to let it sit dry and then you can assume everything is done. So if you just wipe it and then grab it and start using it, the microbe hasn't died yet. It hasn't denatured the proteins on it. So it's really important at least give it 1 minute and then it will be clean. All right, so last topic, and I thought this was very, very interesting, and I've been digging on it, is what about cannabis or marijuana? Well, if you know about cannabis or marijuana, it has CBD and it has THC in it if you are getting a form that has both. You can find some that just have just CBD. What we do know is we do have some in vitro Petri dish studies, and then we have a few animal trials looking at CBD and THC and what their role is in the body. And we do know that they decrease inflammation in the body. They also, THC and CBD, both of them, THC specifically a little bit more, has some antiviral properties as well. So that's really cool, right? We have some agents that can decrease inflammation, and we have some agents that are slightly antiviral. Again, we don't have a lot of research because we've really just started researching this stuff because of federal mandates and legalization processes. But interestingly enough, one of the largest trials right now is actually looking at CBD being used for graft versus host disease. So that would mean you got an organ transplant like lung or new heart, and using that and seeing if it helps prevent some of that inflammatory or that rejection that can happen. And it kills a lot of people actually every year. We use usually immune suppressant drugs or steroids. And it'd be interesting because they are seeing some benefit with that. So we know there is some anti-inflammatory properties, and you know this from pain and other things. The endocannabinoid system is huge, so it has a lot of inflammatory modulating, so it decreases inflammation in the body, which could be a great strategy if you were coming down with something. You may be able to use this as part of your arsenal, or if you're currently using it, it's definitely safe in that aspect. Now, delivery is important. So right now, I would not recommend anybody smoke or vaporize THC, CBD products. Why? Well, right now what we do know is smokers in general, and this is just across the board smoking, it increases that ACE2 receptor site. So your lungs naturally upregulate that when you smoke, and that can be with cigarettes, or it seems to be even with cannabis. But remember, cannabis, we also have the inflammatory perspective versus smoking cigarettes. We don't. It's more inflammatory promoting. But bottom line is we don't want that ACE2 receptor upregulation, because it does seem that people that have higher amounts of those, which is a very inflamed person, this is why if you have a pre-existing condition like heart disease or diabetes or whatever, you're at larger risk of having a very violent response to this coronavirus. Versus if you don't, you're more likely to have a less violent response to this and make it through fine. So do not smoke any of these products, because they likely, from what we see, are upregulating this ACE2. When you have more receptor sites, it's easier for you to catch the infection, and also you get more binding of the virus in the lungs, so you get a larger inoculus of that as well. So if you're currently doing this, it's a great time to stop smoking right now, right? Really, really great time to do that right now. If you are using the CBD or THC products, please use it in other means. You can use it in tinctures and teas and suppositories, etc. There's a bunch of other ways, or orals, that you can take these things if you are familiar with them. If you're not using them, again, don't worry about it. You don't need to add it to your regimen. I'm just pointing it out there for people that are using it, that they should be really careful if you are smoking or vaporizing the product. So I hope these tips, tricks were good for you. If you like this material, please, I'm posting on YouTube too. Hit the like button, subscribe to our YouTube channel. Also, if you have some other topics you want me to talk about, please let me know so I can keep running this out. All right, guys, you have a safe and happy day.